Good afternoon, guys. I have discussion A for you. Okay, we're discussing Slovenia's and assisted dying bill. Now, I've done series on different countries and how they handle their terminally ill uh, patients in those countries and different laws that countries have for end of life care. Okay, so we're going to go through Slovenia's today for A. So please join me in today's presentation A that I made for you. Okay, the text refers to a pivotal moment in Slovenia's democratic process, citizens casting ballots in a binding referendum on whether to legalize assisted dying for terminally ill patients. This vote follows years of debate. A non binding referendum in 2024 and parliamentary approval in July 2025. The referendum was uh, triggered after opponents of the law, primarily conservative groups and the Catholic Church, collected more than 40,000 signatures. The, the threshold required to challenge legalization and force a nationwide decision. Please confirm any election related details with trusted local sources, as voting procedures and outcomes can change. What the proposed law allows. Eligibility criteria. Only mentally competent adults diagnosed with a terminal illness facing unbearable suffering and no chance of recovery would qualify. Process. Patients would self-administer prescribed lethal medication, but only after approval from two independent doctors and completion of a mandatory consultation uh, consult consultation period. Safeguards. Strict oversight is built to prevent misuse, including medical review boards and documentation requirements. Exclusions. Individuals with psychiatric conditions or non terminal illnesses are not eligible under the law. Why there's why there's another vote. Citizen initiative. The referendum was not initiated by the government, but by civil society groups opposed to assisted dying, who argue that life must be protected until natural death. Religious influence. The Catholic Church which holds significant cultural influence in Slovenia, strongly opposes the law, framing it as morally unacceptable. Government position. Prime Minister Robert Golob's liberal government supports the law, presenting it as a matter of dignity, autonomy, and compassion for those enduring end of life suffering. Timeline background. 2024, a non binding referendum showed majority public support for assisted dying, signaling a shift in societal attitudes. July 2025, Parliament passes the law, citing the earlier referendum as evidence of democratic backing. November 2023, or November 23, 2025, Slovenians voted in a binding referendum to decide whether the law should be implemented or suspended. European contexts. Slovenians debate is part of a broader European conversation about end of life rights. Belgium, Netherlands, Luxembourg, among the most permissive, allowing euthanasia under strict conditions. Switzerland permits assisted suicide, often facilitated through organizations like Diagnostics. And Australia and Spain recently legalized assisted dying, reflecting growing, growing acceptance across Europe. Slovenia's referendum is notable because few countries have put such sensitive issue directly to a public vote, making it a test case for how democratic processes handle ethical dilemmas. What to watch next? Referendum outcome. A yes vote means the law will take effect with safeguards and oversight mechanisms guiding implementation. A no vote suspends the law, likely prompting further parliamentary debate or judicial review. Implementation challenges. If upheld, Slovenia must establish clear medical protocols, training for doctors, and monitoring systems to ensure compliance. Regional influence. The decision could inspire or deter similar initiatives in neighboring countries, especially in Central and Eastern Europe, where assisted dying remains controversial. Please verify the final results and any implementation timelines with official Slovenian sources or reputable news outlets. Okay, guys. The reason why I did this show today is to show that each country has its own laws for people's if they have terminal illnesses, there are ways to handle that by law. What I mean by that is you have to get the proper documentation. You have to go through the proper channels. You have to be able to self-administer medication for that. Um, there's lots of hoops that people have to go through when they take that route. Normally someone gets when someone has a terminal illness, normally somebody gets a hold of hospice or something equivalent to that, supporting them with their end of life care. That's the typical way of doing things. But different countries handle terminal illness differently. So that is why I chose to do this show for this subject this morning. So with that being said, I just wanted to explain to everybody why I chose this one to do. So everybody gets the right idea for my show. For now, Gator Wellness, take care, folks.